With the pandemic, we were really sort of faced with some key areas that we needed to develop in. There was generally just a lack of sort of organizational capacity that we needed to build up, but there was also a realization that we really had some serious disparities in our population. We were always aware of that because New Mexico is a very poor state. But we really renewed our effort to make health equity central to our mission at the New Mexico Department of Health. And that really means a lot of things. It's a lot of work and it's a lot of community engagement. We're really reevaluating all of our community health assessments from the ground up. We're re-engaging community organizations and partnerships. And we're developing, in fact, a state health improvement plan that ties in together many health-related agencies and the private sector, the hospital systems, the universities, lots of different community organizations, and we're doing that so that we can start addressing health equity from the perspective that we need to address social determinants of health. And when we do that, when we actually go upstream to solve problems, we actually get at those disparities downstream, but it involves a very thorough undertaking that's very involved and time-consuming, and we're very excited about it. And that really involves the work that we're doing with PHAB through our public health accreditation. That really drives our evolution, and it really demands that we develop methods for measuring our outputs at the Department of Health. So we're really trying to drive a culture of equity. We're trying to drive a culture of quality, and we're also trying to develop a performance management system rather than just doing performance measurement. So, and that's very strategic. So becoming more strategically aligned with what our objectives are, making sure our performance measures are articulated correctly, they have the right targets, they're actually measuring activities that we want to promote in the state, and they're strategically aligned with what we're trying to accomplish as an agency around health is something that we're really committed to right now.